Hi, I'm Tom Hanley and I'm the Managing Director of Singular Health. Today, we're going to demonstrate how a patient can view their CT and MRI files in 3 dimensions with the doctor in the doctor's office, how that doctor is going to use those 3-dimensional images to demonstrate to the patient the type of care they're going to get, and then transfer those images onto their mobile phone in 3D so the patient can then take that with them and show their friends and family. Come on, follow me.
Oh, hi Tom.
Dr. Smith, how are you?
Good to see you.
Thank you very much.
Come on in, have a seat.
I will.
We'll have a look at your scans.
Right, I guess you've got something to show me today.
Yes, that's right. We'll have a look at them together and hopefully you'll be able to understand a bit more. We've had your scan. We don't know what we're dealing with just yet, but we can run through your scans. But basically we've found a lesion, a small lump on your lung. I'll just show that to you on the screen here.
A lesion? What does that mean?
Well, you can see a little growth there.
Yep.
Can you see there?
I can see that growth there, but I've got to be honest with you, it looks no different to the other little lumps there to the untrained eye.
Yep. Well, it's a little bit different color, and you see the shapes are regular, but perhaps it's a little bit difficult to appreciate this in 2D, so I can show it to you in 3D.
You can show it to me in 3D?
Yeah, I can. So if you just bear with me, I'll just load it up in 3D. Okay.
So what am I looking at here, Dr. Smith?
So if you have a look, normally this is what the lung looks like. I'll just make it a little bit. So that's what you saw earlier on.
Yeah, I do see that
contrast, and
yep.
you can see that whiteness there.
Right.
And you say that's a little bit different. It's no different to the other whiteness, but then I'm just gonna change the image a little bit so you can see the blood vessels and actually the airway of the lung. So as you can see, we've taken off the soft tissue of the lung.
Yeah.
And what is remaining here are the airways.
Yep.
And within the airway, you can see that there's a growth there that seems to be coming from one of the airways.
Wow.
So we suspect this is a tumor of the lung. Now, whether it's benign or malignant, we'll have to biopsy of it.
Okay.
But certainly at the moment, I'm thinking this could be a malignant lesion of the lung, primary of the lung, just by looking at the characteristics of it, because there's only one. Let's zoom out a little bit so then we can show you the rest of the lung. So as you can see, as we go through the lung,
I see that, yep.
There's no other lesion there.
Wow, okay.
Okay, so we can look from here. So it gives you a
Can
better
we make
view
that a
on a
little brighter
diagonal.
maybe?
Yeah, we can.
Okay.
There you go.
Terrific.
So this is the lesion that we're looking at.
Yep.
And obviously we look at for the rest of the lung here for whether there's any other lesions.
Now you said this was a primary. What does that mean?
Primary means that if it's malignant, it's more likely to be a cancer of the lung rather than a cancer that's come from somewhere else.
Yeah.
That's gone to the lung.
Okay.
Usually with what we call metastatic cancer, it has multiple lesions and not a single lesion. And also the characteristics of it are a little bit smoother, whereas this is what we call a spiculated lung lesion.
Yeah.
And there's only one, so it makes me think that it's a primary of the lung. However, I'm not saying this is malignant yet.
Right.
What we
So
need
I shouldn't
to do,
be too worried at the moment.
Well, I think, I'm not saying don't worry. I think, there is cause to investigate further.
Okay.
And what we need to do is get a biopsy, and what the radiologist will do, we'll probably put a needle from here. I'll just get this out. So from 3D viewpoint, they're going to put a needle from here.
And that's through my back, I can see that.
Through there, yep, that's right, because that's the closest route, as you can see.
I can see that.
From here, rather than going from here down to here,
Yeah.
you can see that it's easier to go from here to here, through the rib here,
Yep.
because that's a soft tissue there rather than going, so they'll put a needle through there into the tumor,
Well, that's a lot
extract some
clearer.
cells,
Yeah.
and then send it off to histology, and then it'll take about 2 weeks, and then we'll have a result to see what type of tumor it is, whether it's malignant or benign, or what type of tumor it is
Yeah.
as well. And then we will know what type of treatment to embark upon,
Okay.
whether that be surgery or radiation or
Cool.
chemotherapy.
I understand. And look, when I got my scans from the radiology clinic, they came up on my phone only in those 2D, but I'd love to show this to my wife at home and just give an idea of, what I'm looking at here.
Sure.
Is there any way I could get this onto my phone?
Yep, I'll just do that for you and just share. What's your email?
thanley@singular.health.
Okay. I'll just send that to you.
Terrific, and that's just going to pop up in my email and my...
Yep, it should pop on your email and you open it, and it should ask you to download the application,
Okay.
and you should be able to see it on your phone. You can check once we've finished this, and we'll cut there. So if you now have a look at your phone, we'll close that.
Right.
You have a look at your phone and just double check that you've got that.
All right, Dr. Smith. Well, I've downloaded the software I saw in the email.
Yep.
Can you help me drive what I'm looking at?
Sure.
My wife?
You just have a look. So, as you can see on the screen, this is the lesion here.
Yes.
You can make that a little bit bigger, so you can see that, but that's probably a bit too big. But
Okay. I can really distinguish that now.
now you can see that that's the lump there.
Yeah.
And what the radiologist will do, will stick a needle into that lesion there.
Yeah.
And they'll probably either go through from there, where you can see in between the ribs, through there, or they'll probably go through here, which is a shorter route.
Okay.
It really depends on what they decide. What they'll do is they'll have a look at the CT scan and orientate themselves as to which position is the easiest way to get to the lesion. If you have a look, that's the lesion there.
Yeah. Just there.
Yep. And the radiologist will decide and orientate themselves to see how they'll approach this. But I think this would probably be the route they go through, because this is the shortest distance to get to it, and it's between the two ribs there.
I see.
Where the needle can go through, or they can go through here, in between the two ribs there, into there. But they'll make a decision, and they're all very good at the interventional radiologists at doing that. But they'll be able to appreciate that quite easily.
Okay.
But perhaps you can appreciate it a little bit better on this 3D rather than the 2D, scan. Yeah. Do you have any questions?
No, I'll just take this home and show my wife, and I'm sure she'll be just as concerned. But yeah, when will I be booked in for my biopsy then?
Well, we'll try to get the girls to organise the earliest appointment for you. But obviously, I know you're concerned, but we don't know whether this is malignant or benign yet, and we need to get the biopsy done. And about 2 weeks after the biopsy, come back and see me, and then we should have the results, and then we'll go from there.
Right.
And if you have any questions, just send me an email, and we can point things out on the scan for you.
Great. Thank you very much.
No problem.
So there you go. After a 10-minute consultation, the simple and easy way of transferring 3D CT scans from your clinician's computer to your phone has been demonstrated. So, within the clinician's workflow, he's been able to demonstrate to me the CT scan in 3D and transfer that to my mobile phone for me to show my family at home.